An obstructed airway, or choking, is the most common cause of respiratory emergency. First, determine if the victim is choking. If the victim is coughing forcefully, he is still getting oxygen. Encourage him to keep coughing.
Keep coughing.
When a conscious victim can no longer cough, speak, or breathe, he may be choking. Summon EMS personnel and obtain consent.
Greg, call 911. We have a choking emergency. I'm a trained professional. May I help you?
First, give 5 back blows to help push the object out of the airway. Position yourself slightly behind the victim. Provide support by placing one arm diagonally across the chest and have the victim lean forward. With the heel of your other hand, firmly strike the victim 5 times between the shoulder blades. Each back blow should be a distinct attempt to dislodge the object. If the back blows do not dislodge the object, give 5 abdominal thrusts. Use one hand to find the navel. Place the thumb side of your fist against the middle of the victim's abdomen, just above the navel. Grab your fist with your other hand and give 5 quick upward thrusts into the abdomen. Each abdominal thrust should be a distinct attempt to dislodge the object. Continue giving 5 back blows and 5 abdominal thrusts until the object is forced out, until the victim starts to cough, speak, or breathe on his own, or until the victim becomes unconscious. If the victim is obviously pregnant, known to be pregnant, or too large for your arms to reach around, do not give abdominal thrusts. Give 5 chest thrusts instead. For a pregnant victim, adjust your hand position to be slightly higher on the center of the victim's chest. Care for a conscious choking child using the same technique as you would for an adult.
Keep coughing. Are you choking?
Summon EMS personnel and obtain consent from a parent or guardian. If no parent or guardian is available, do not delay care. Consent is implied.
Lean forward.
Depending on the child's size, you may have to adjust your height and kneel behind the child. When doing back blows and abdominal thrusts on a child, use less force than you would on an adult. Using too much force may cause internal injuries. If an infant is conscious but is unable to cough, cry, or breathe, she may be choking. Use back blows and chest thrusts to dislodge the object. Summon EMS personnel and obtain consent from a parent or guardian if possible. Do not delay care.
Call 911. Tell them we have an infant who's choking.
Carefully position the infant face down along your forearm, supporting the head and neck. Then lower your forearm to your thigh for support. The infant's head should be lower than the chest. Using the heel of your hand, give 5 firm back blows between the infant's shoulder blades. Be careful not to hit the infant's head. Each back blow is a distinct attempt to dislodge the object. Next, position the infant between both of your forearms, carefully supporting the head and neck. Turn the infant face up and again lower your forearm onto your thigh for support. To locate the position for chest thrusts, place 2 or 3 fingers on the center of the chest just below the nipple line. Give 5 chest thrusts. Smoothly compress the chest about 1/2 to 1 inch. Continue giving 5 back blows and 5 chest thrusts until the object is forced out, until the infant begins to cough, cry, or breathe on his or her own, or until the infant becomes unconscious. To review, if a conscious adult cannot cough, speak, or breathe, he may be choking. Summon EMS personnel and obtain
Call
consent.
911. We have a choking victim. I'm a trained rescuer. Can I help you?
Stand slightly behind the victim.
Lean forward.
Give 5 back blows. Give 5 abdominal thrusts. For a child, follow the same steps, but you may need to adjust your height or kneel.
Lean forward.
Back blows and abdominal thrusts are not as forceful for a child as they are for an adult. Remember to summon advanced medical personnel and get consent from a parent or guardian if possible. If a conscious infant cannot cough, cry, or breathe, she may be choking. Summon EMS personnel and obtain consent from a parent or guardian. Position the infant face down and give 5 back blows. Turn the infant face up and give 5 chest thrusts. For victims of all ages, continue giving back blows and abdominal thrusts or chest thrusts until the object is forced out, until the victim begins to cough, speak, or breathe on his or her own, or until the victim becomes unconscious.